Good day, my name is Ronell and here with me is Mrs. Thompson. Alright, my medical patient today is a patient that has fainted and is unresponsive. Alright, I arrive at my scene. At my scene, I check if the scene is safe. The scene is safe. The number of patients, 1. Nature of illness, it's a syncope that has led to unresponsiveness. Alright, I will also consider, because of a falling case, I will consider taking spinal immobilization. Also, I want to advise ALS to stand by. My general impression of this patient is a female patient that found lying supine, no signs of deformities, no signs of bleeding, and appears to be breathing. Alright? I will approach the patient in the line of sight. In approaching the patient, there's someone that is standing by at the patient. I will talk to the person. My name is Ronell and this is my partner, Mrs. Thompson. We are EMTs here to help. Could you tell me what happened here? Susie and I were dancing and exercising, and the next thing I know, Susie held her head and she fell. Alright? Could you tell me when she fell, she hit her head? No, she didn't hit her head. Alright, good. I approached Susie. Susie, my name is Ryan. Can you hear me? No response. Alright? I will now apply painful stimuli. Susie groans. Sorry, Susie's responding to pain. Alright? At this point, I will do a head tilt. Alright? Look in the airway. Alright? Look for obstructions. No obstructions found. Alright? At this point, I will also listen for breath. I will look for rise and fall of the chest. Alright? So look, listen, feel. Alright? I can feel air coming, looking for 30 seconds. Alright, so at this point, I realize that she's in fact breathing. Alright? She has good rise and fall. And her tidal volume is adequate. Alright? No adventitious lung sounds heard without auscultation. Alright? At this point, I will auscultate the lungs skin to skin anteriorly. So, right apex, left apex, left base, right base, mid axillary, right, mid axillary, left. No lung sound, abnormal lung sounds found using auscultation. Alright? I will now check for the circulation. Check the radial pulse bilaterally. So I check the radial pulse bilaterally. Also, I want to take in consideration the skin condition, specifically the color, hydration, and cap refill. Alright? So radially, the pulse was rapid and weak. Cap refill is sluggish. Skin condition, it is moist and pale. Alright? At this point, I will ask my partner to get a set of vitals, specifically a GMR reading, O2 sat, and a blood pressure reading, while I ask the bystander to give me some more information. Alright? So you told me what happened here the last thing before she fainted, right? Could you tell me if the person is on any medication, if Susie's on any medication? Yes, Susie's on medication. Susie's a diabetic patient, and I think she uses insulin. I think she uses insulin even before this happened. Alright, good. When was the last time that Susie ate? We went to the restaurant this morning, but I didn't see her eating any food. Alright? Do you know if Susie's allergic to any medication? No, I'm not sure if Susie's allergic to any medication. Alright? I already know the signs and symptoms that I'm seeing, and we already know the event that led up to this happening. So, my partner, have you finished taking the vitals?
Sure have.
Alright, good. Alright, so what is the vitals?
Alright, so the blood pressure is at 124/80.
Alright, blood pressure 124/80.
Oxygen sat 96%.
Oxygen O2 sat 96%.
the GMR 1.2 millimoles.
And the GMR 1.2 millimoles. Alright, so considering what I learned from the sample and the vitals, I now prioritize this patient as a critical patient. So I will use this patient I will treat this patient as a load and go. Alright? Also, I want to consider that this patient is possibly hypoglycemic. Alright, so now I want to advise ALS to intercept us on transport because I cannot give this patient medication. This patient needs glucose either intravenously or intramuscularly. Alright, so I will now package this patient, place her on a stretcher, put her in the ambulance. In the ambulance, I will now do a systematic head-to-toe check. Alright, so I will check her head, I will check her ears using the acronym BTLS-IC. Alright, so look in the ears of if there's no bleeding, both ears. Alright, we can check the eyes for pupillary reaction. If it's reacting to light, pupils are reacting to light. Alright, can check the jaw, check the neck, alright, for trachea deviation or tracheal jugular vein distension. Check the shoulders, check the extremities. Alright. Also this time I want to auscultate lung zones both anteriorly and posteriorly. Alright, so check again. Check mid axillary. Alright. My partner will help me log roll the patient while we check apex, base, alright? Alright. So, log roll the patient, check for lung zones, still no adventitious lung zones, alright? Also, we palpate the abdomen, the 4 quadrant, looking at the face for grimace, alright? The side, the pelvis, press and pull, looking for instability, alright? Lower extremities, dorsalis pedis, checking for pulse, alright? Found pulse there. I would not check for motor sensation at this point. So at this point, as a priority patient, I will recheck vitals, specifically blood pressure, pupillary reaction, O2 sat every 5 minutes. Alright? Do a GMR check until ALS arrives or I reach the hospital.